You know, there's been a lot of talk lately about schools reopening. San Diego Unified just announced a targeted reopening date of April 12th after a year of distance learning for 130,000 kids and a lot of learning loss. There's also been a lot of confusion over the demands by the district and unions on how vaccinating all teachers is a must to keep everyone safe, despite CDC guidance saying the opposite. To clear up some of the confusion and to show that schools can reopen safely right now, we turn to the Cajon Valley Union School District. Superintendent David Miyashiro joins us this morning to share how his district is keeping students and teachers safe. Good morning to you, David. Thanks for being here.
Good morning, Eric. Good to see you again.
Well, you and I have exchanged a few emails here, and I was just surprised by the hard numbers here. Your district opened in April of last year, so 10 months ago. How many COVID cases in 10 months has the district had?
So after 10 months serving almost 10,500 students on a regular basis, we've had 3 after contact tracing cases of transmission. 2 of those were between staff not wearing masks and not social distancing. So you eliminate those, and we had 1 case of a one-to-one student in a special needs class transmit to the aide. And that's 1 too many, but 1 case in 10 months with 11,000 students, we're demonstrating that it's safe. And El Cajon has one of the highest case rates in the county as well. So a lot of the excuses that you hear are really just that, excuses.
Yeah, and parents are saying that the unions and a lot of the other districts are coming up with a lot of excuses to not be in the class and that they want to be safe to get back onto campus, which you understand, but you're showing that you can be safe. You can reopen. You can have kids in classes learning and not having this learning loss.
Right.
So what changes have you made? I mean, if a district is watching this, some superintendents obviously need some guidance around the county right now. What's your advice? How have you been able to pull this off?
Well, we started by listening to our parents. So early in the pandemic, all schools were told to do 3 things: feed students, provide distance learning, and open free childcare for essential workers if you can. And in April, we asked our parents, would you need childcare if we provided free essential worker childcare? And the response was overwhelming. Our parents said, we don't have an option. Both of us have to work. No one's home for our kids to help them with distance learning. And that's why we opened, and we started small with just a couple hundred kids. Our extended day program opened up, and that was before there were any safety guidelines or rules or even mask wearing protocols. So we went to Trader Joe's and watched how they set up their store with the markers on the floor and the plexiglass and the directionality, and slowly just built, with the help of public health, our safety guidelines, very conservative. And now that they're in place, we're able to scale up. We serve 6,500 students during the summertime with free summer learning and enrichment. And then after Labor Day, open school for all parents who wanted to send their children for in-person learning.
Are they in class all day there too?
At some schools, some of our schools are open 5 days a week, and some of our schools are open in hybrid. Our goal now is to return all of our schools to a pre-pandemic schedule.
Wow, and that is the dream of a lot of parents around the county, people watching this right now who've gone through so much learning loss. Speaking of learning loss, have you noticed that at all, or the kids seem like they're on track?
I don't like the term learning loss. We have 13 years with every child, and as long as we're using adaptive technologies with reading, language arts, and math, and monitoring their progress, that's the goal.
Gotcha.
So learning loss, I mean, it's just it's a bad term to use. I think let's just focus on growth and progress monitoring. Our kids are going to be fine. My biggest concern is the social emotional well-being, their mental health, and for kids that haven't been able to socialize with their peers and the adults at school that care about them.
Yeah.
That's more of a concern.
Yeah, definitely. That makes sense. Let's talk about testing. I think the last time we spoke, we showed everyone how you guys have been pulling off the testing. Walk us through how you're doing it and how that could be a model for some of the districts as well.
There's a local company called Cal Biotech, and Shannon Handy from News 8 came out and did a story on it. And we're using a saliva pool sample as a pilot. It's a very cost-effective, very efficient way to quickly test students and get a same-day turnaround with a test. And we're also using some guidance from San Diego Public Health and the doctors there that are running pilots. We have a pilot at Vista Grande Elementary School where they're doing the PCR nasal swabs in addition to some wastewater sampling. So we're utilizing science and research and our partners to help figure out how to best move forward.
Wow.
But really, I mean, the testing, we didn't have any spread prior to that, so I don't see it as necessary to continue. And right now, the state legislatures, they're making decisions on, is that even going to be something they're going to enforce upon all school districts?
Wow. And you
That's
guys,
happening right now as we speak.
and David, you guys have posted a lot of your protocols and everything on the district's website if some of the districts need a little help and guidance right now, because obviously they do. So many of them haven't opened up, but they can learn more from your website, right?
Yeah, our COVID safety plan is on the first page, and then there's a whole section on our COVID website that has all the protocols, forms, communications for parents. It's all there for anyone to use.
Superintendent Miyashiro from Cone Valley, really appreciate your time this morning and keep up the great work, keeping our kids safe, our teachers safe, and keeping the schools open. Thank you, sir.
Thank you, Eric. Let's get our kids back to school.
That's the goal, I think, and districts have these different approaches of doing it, and what you're doing is a recipe for success, so thanks for sharing it this morning.
Thank you.
It's amazing. They're in a district that's had a lot of cases. They've been open for 10 months. They've had 10,000 kids come back. They've had one case.
So 10,000 students are back.
They're back in multiple different layers. Some
Okay.
are 5 days, some are full-time. Their goal is to get full-time,
Right.
but they have just taken it head on since the beginning and been working with the state. They've been testing. They've been doing all the things they need to do,
Yeah.
and they've been able to stay open and get the kids in the classroom.
And as we've been reporting, San Diego Unified, it's 130,000 students in that district, but they're planning hopefully to start middle of April. So
Yeah.
they can look to that district to
Yep.
see how to do it.
Learn a lot from them. All right.